A very warm welcome to one and all of you. First of all, we would like to wish you all a very happy Pharmacist Day. So, commemorating the first anniversary of the Federation of Clinical Pharmacists in India, we are organizing today's panel discussion on BPS Pharmacist Certification in collaboration with the Board of Pharmacy Specialties. So I am Vrinda Namputri and I am the moderator for today's session. I would like to welcome our expert panelists. We have Brian Lawson, who is the Associate Executive Director with the Board of Pharmacy Specialties. He leads the professional affairs, communication, and engagement team that is responsible for monitoring the professional pharmacy landscape in the US and around the globe and developing collaborative relationships within the healthcare community to promote the value of BPS board certification. We have two of FCPI's board of directors as panelists who are also selected to serve as BPS ambassadors. That is Grace Mary John and Mohammed Hisham. Grace Mary John became board certified in infectious diseases in 2021, and she's the first board certified pharmacist from India. She's currently working as the chief clinical pharmacist at Believers Church Medical College Hospital at Tiruvalla in Kerala. In India. She has also been selected to serve as an international ambassador for the Society of Healthcare Epidemiology of America. Mohammad Hisham is a board certified in critical care since 2017 and in infectious diseases since 2020. He is a dynamic and passionate clinical pharmacist working in Cleveland Clinic Abu Dhabi in UAE. Hisham also holds faculty positions in various international universities. Also joining the expert panel is Ajmal Karimbaru-Kuril, who is a board-certified infectious diseases clinical pharmacist since 2023. He's currently working as a clinical pharmacist with a strong focus on clinical research and antibiotic stewardship initiatives at Emirates Health Services UAE. And we also have Anita and Sunny, who became board certified in pharmacotherapy in 2022. And she's currently working as a pharmacotherapy specialist in the Department of Neurology at KMCH Hospital in Coimbatore in India. Her special interests include neuroimmunology disorders, epilepsy, stroke, and Parkinson's disease, along with clinical research activities. So we'll discuss everything you need to know about BPS certification, BPS pharmacist certification. Please note that the information that we'll be discussing today is as per the BPS website as of 25th September 2023. Since these are periodically updated, we would like to request all the participants to please make sure that you visit the website for more updates. FCPI had put a social media post inviting questions from participants on BPS certification. We'll discuss as many of these questions as possible during the session today. If time permits, we'll also take live questions from the participants. Please note that we'll not be taking a question if it has already been discussed during the session. So to begin with today's panel discussion, Brian, could you briefly walk us through the history of BPS formation, and could you also highlight on what are the key benefits of taking a BPS certification for pharmacists?
Absolutely, and thank you so much for having me with you guys. BPS really was a brainchild of some conversations during the American Pharmacists Association and their task force on specialties in pharmacy practice in 1973, which this really led to a conversation around what is the role of pharmacy specialties in the profession. And this was probably about 40 years after the medical societies had created board certification for physicians. And so there was enough momentum to create the task force, but also organize BPS as an autonomous division of the American Pharmacists Association to recognize specialty practice in pharmacy, define standards, evaluate the knowledge and skills of pharmacy specialties, and then obviously communicate the importance of specialization, which is a lot of why we're here today. Over the years, we have grown the number of board certifications from 5 to 14, including the transferring the certified geriatric pharmacist credential to BPS in 2017. And so we have similarly, as other countries, a long history of learning how do we position pharmacists to really advocate and contribute to practice areas at a very advanced level. The countries in which pharmacist board certification has grown have really adopted and adapted the US model for pharmacy education, training, and practice. And pharmacists tell us that they use board certification and its exam to benchmark their knowledge, skills, and experience against internationally recognized standard. And so what we also hear is that board certified pharmacist and board certification contributes to professional and career pathways, and really contributes to someone's confidence when communicating with members of the healthcare team as well as with patients. And so I would say that one of the huge benefits of board certification is really identifying which pharmacists are validated to practice at those advanced patient levels and which ones are not.
Thank you so much, Brian. I think that really helps us to get an understanding about BPS, and it would have given a context to our participants as well. So thank you, Sarah. Moving on. So these are the various specialties for which BPS certification is currently available or provided. So a few of these specialties may not be relevant in India at the moment. So this graph here shows the number of board certified pharmacists from selected countries in the Indian subcontinent, Middle East, and North Africa, from where I believe most of our participants today are coming from. So as you can see here, from India specifically, there are currently 4 BPS certified pharmacists. And this includes 1 in oncology, 1 in infectious diseases, and 2 pharmacists in pharmacotherapy. So we have received a question from a participant, and the question goes like, what are the benefits of taking a BPS certification as a pharmacist who is practicing in India? That is, whether BPS certification can change the way clinical pharmacists work in India, and will it help them to get better involved in making treatment decisions and managing medications collaboratively with other healthcare professionals? I would like to direct this question to Anita, as she's a board certified pharmacist, as well as someone who's working in India currently.
Good evening, all, and thank you so much for inviting me into this panel discussion. And let me take this first question. So it's like the knowledge you gain while you do this board certification and during the preparation will help you a lot in your clinical practice. The decision making, the choice of treatment based on the clinical condition, and discussing with other healthcare professionals is always an add-on and an advantage which you require, and which is something which you gain while preparing for the certification exam. It's not just the treatment, the pharmacological treatment alone that you're trying to learn from the certification process, but it also includes how to communicate with other people, including the patient, caregivers, as well as the healthcare professionals, and the way you want to educate other people, including all these 3 categories, and how to improvise yourself. So, no doubt in improving your career and profession as a clinical pharmacist. And I'm sure that you're going to benefit a lot in your practice, as well as your patients are going to get specialized care. It's not something which you give as a routine clinical pharmacist. But once you do the certification, you will identify yourself as someone very unique and different from other people who are practicing. Uh, while preparing for this exam itself, I noticed a change in my practice and the way I could do the communication, and the way my physicians and my team was ready to welcome and accept the suggestions from my side. The evidence-based medicine I could refer and tell them, and the way they were open to my suggestion, and how they were trying to accommodate those changes, and my patients, when they came to know that how much I have done my work for them and what all preparation I have done regarding their treatment. So they all were willing so much to accept those changes, and they were ready to welcome us as a clinical pharmacist, as a pharmacotherapy specialist. And when you want to provide a specialized care, of course, you need to have a good knowledge basis regarding whatever you tell. You can't just go and blabber something in front of them, because it should make some sense for both the physicians, the patient who is receiving the treatment, as well as the caregivers who are providing the care for the patient. So if you can convince all these people together, it's going to give a fantastic outcome. It's not just about giving some medicine and treating the patient based on some lab reports, but after all, you're trying to improve the outcome for the patient. So when you prepare, you'll understand it's not just the drug or the medicine which you're giving, but also the communication which you should maintain well with the patient as well as the people who are in the team, which will improve the treatment results. So, no doubt in taking this board certification and the benefits and the advantages you are going to face and know in your practical experience is going to be like, I don't know, it's not going to end as a list if I put a number to it. So, let me be short in describing this. We'll move on, Brunta.
Thank you so much, Anita. I hope Anita has been able to clarify that doubt, which many of you might be having. And I'm sure she has been able to convince most of you that BPS certification has really impacted her career, as well as the way in which she delivers patient care. So moving on, coming to the eligibility criteria. So as a bare minimum requirement to apply for BPS certification, the candidate must possess a pharmacy degree, which is a bachelor in pharmacy degree or a doctor of pharmacy degree, along with a license to practice pharmacy from their country of training. Now, if the candidate has moved out of country and is currently practicing in a different country, the candidate should also possess a pharmacy license to practice in the country of residence as well. Now, in addition to that, residencies, additional degrees, other board certifications, these all would be helpful, but it is not mandatory for applying for BPS certification. Kindly note that the residency programs, which are accredited only by American Society of Health System Pharmacists, are considered eligible for application. Now, a question that we have received is whether BPharm graduates and pharmacy college faculty are eligible to take BPS exam. So, Brian, could you respond to this question?
Absolutely. And, also want to clarify that BPS has recently recognized the Canadian Residency Board's process for residency programs. That's actually even another country that's really been woven into our eligibility criteria. But we also recognize that everyone practices in a little different way. The breadth, the depth, the scope of pharmacy practice varies within institutions, among institutions, even among different jurisdictions. And so one of the cornerstones of board certification is the job analysis. And we conduct that every 5 years, and it looks at contemporary pharmacy practice, looking at qualitative methods. And these job analyses inform the content outline, which is used for eligibility, exam development, recertification offerings. The good news with these job analyses is that we look at pharmacists who practice in different settings and in different roles. And so we do have a number of pharmacists who practice as faculty. And so faculty are a part of the cohort that can be eligible to sit for the exam as long as they practice in any or all the areas identified within the content outline. One of the things that if folks aren't able to complete a residency program, we do have a experience pathway, which I know we'll talk about a little bit later, but that pathway for practice experience does require an employer attestation that the pharmacist who is applying for our exam has the years of experience and the coverage within the exam content outline to validate that they are eligible for the exam. And so I'd say it really depends, but even in the US, I can tell you that a number of universities and colleges of pharmacy require faculty to have board certification as a part of their hiring or as a part of their tenure and promotion process. So we do have faculty that can be eligible for the exam.
Just as an extension to that question, suppose faculty is going to take BPS certification, what would you say are some of the benefits if such a faculty were to take this exam?
No, it's a really good question. And I would say it's really, faculty serve as mentors to our learners and students. And so it really helps create some connectivity around the importance of board certification to articulate that this is a part of someone's commitment to lifelong learning. So learning doesn't just stop in the university or the College of Pharmacy. Yeah. It continues on after someone graduates and they get their BPharm. And so for faculty, it's their lifelong learning to make sure that they're being competent in the updated treatment guidelines, the medications, the disease states in which we're supposed to treat. And then obviously for the students to see that their mentors are also holding board certification, it really helps serves as a motivator for them to pursue board certification as well.
Thank you. So I think that would have motivated at least some of the faculties who have joined today's discussion to go for board certification. I'm sure if they also go for the certification, they'll also be able to mentor the students in a better way as well, in a more practical way. So thank you so much. So for BPS certification, the candidates must be a graduate from a pharmacy program, which is accredited by the Accreditation Council for Pharmacy Education. In case of international candidates, a program outside the US, which qualifies an individual to practice in their jurisdiction. And they also require an active license to practice pharmacy. So now just talking about eligibility criteria for the different specialties. First, let's discuss about pharmacotherapy certification. Here, the eligibility criteria includes at least 3 years of pharmacotherapy practice experience within the past 7 years, with at least 50% of time spent in the scope, which is defined by the exam content outline. Or the candidate should have completed PGY1, that's postgraduate year 1 pharmacy residency, within the past 7 years of application date. Along with this, definitely the candidate should also achieve a passing score on the BPS pharmacotherapy certification examination. But when you look at the other specialties, for example, infectious diseases, the criteria is a bit different. So Grace, as someone who has taken the infectious diseases certification, could you explain to us how the eligibility criteria is different for infectious diseases and other specialties, please?
Thank you, Vrinda. Happy Pharmacist Day, World Pharmacist Day to all of you as well. Regarding the specialty certifications, like you have already explained regarding the pharmacotherapy, there is a bit of a change when it comes to the other specialties because it's more advanced when you compare with the pharmacotherapy. Therefore, the PGY1 and PGY2, which is the postgraduate year 1 and postgraduate year 2, I want to mention here, reiterate the fact that I think, Vrinda, you had already mentioned that this postgraduate year 1 and year 2 refers to the ASHP accredited residency programs, not the residency programs that we have currently in India, where multiple hospitals or academic institutions have started, but it has to be an ASHP accredited PGY1 Y2. So in case if a person has completed the PGY1 and Y2 in an ASHP accredited residency, they can straight away take the exam when it comes to for example, let me give you BCIDP, the infectious diseases. If they have completed the PGY1 and later PGY2 in infectious diseases, they straight away can go into the board certification exam. Or, or for people who have completed the PGY1 and if they have at least 2 years of experience post their PGY1 residency, they can also take this exam. So what I mean with experience is that 50%, if 2 years of practical experience, what they mean is that in that each 2 year, you should have at least 50% in that specific specialty you need to take, which means 50% of infectious diseases, related activities that you do within your practice experience is what is mentioned. But for example, take a country like India where the residency programs are not yet, up and running. The option that we have is that post our graduation, let's say B.Pharm or PharmD or your M.Pharm pharmacy practice, whichever graduation that you have passed, if you have, patient care experience, a practice experience with at least 50% in 4 years is what is required as the minimum requirement to take the board certification exam. So basically, after your graduation, you enter a hospital, you be with the patient, you be in that patient care, and 50% of that experience, whether it is oncology, whether it is ID, whether it is, ambulatory care, critical care, 50% is what you require after 4 years. Now, the question that we usually get is that if I have, let's say, 2 years of 100% experience in ID, after my completion, I was straight away into ID and I've been seeing only ID throughout my career. I've been only seeing ID for 2 years. Am I eligible? That is not the case. You need at least 4 years You can't have 100% for 2 years. You need 4 years with minimum 50%. Or I had 4 years with 100% ID, but it doesn't matter. At least 50 is what you need. So that is a requirement to have, to make yourself eligible to write the exam. Then you get the, the minimum score for passing the exam. That what gets you to the board certified pharmacist post.
I think one question that we have here is, since BPS is a American board certification, whether NAPLEX, whether the candidates need to pass NAPLEX exam if they have to attend BPS certification.
Yeah.
Grace, would you like to answer that? Yeah.
Yeah. So thank you again for that brilliant question, because we know a lot of Indians, we do migrate to other countries as well. So if you take for NAPLEX, for example, in the US, so NAPLEX is not mandatory that you have to take the BCPS examination, any kind, whether it is BCPS, whether it is BCIDP, for any exam, you don't necessarily need NAPLEX. But if you look at the previous slides, you know that the eligibility criteria for you to write the exam is to have the license. So automatically that licensing exam is what is needed. But we see the BPS examinations, you do not require the NAPLEX as such to write the exam. You can start preparing. That's a good thing.
So just one more question on this specific topic. So a participant has asked the advantage of board certification over pharmacy residency and as to which one is better. So the participant has compared pharmacy residency and board certification. So how would you answer to that?
So I think that, thank you. So I think that question is between the completion of PG1 and Y2 versus 4 years of experience is what they are asking. See, we can't straight away answer that one is better than the other. Obviously, it is not. Going through a teaching program where you see cases where you are structured into a program gives you a lot of exposure to that program. That's what residency gives you. But what the Board of Pharmacy Specialty has done is that for others who couldn't do the residency, it's such a big opportunity for others to take that. If you are, let's say, if you are so much passionate about that one specialty and you are spending your time with the patient, and you love your patients and you want to do better, you want to adhere to all the guidelines to make sure, everything goes well. So for such people, it is such a great thing that the Board of Pharmacy Specialty has done that, you can have the 4 years experience at the minimum with 50% of what you have to write the exam. And obviously you're both certified, nobody is good. I mean, in India, that's the most major problem that we are facing, right? Who are you to tell us what to do? Yes, I am a board certified pharmacist, I have gone through this process. I have learned through the process, which gives you that confidence. That is what, Brian also said, that reiterating that confidence is what you get while you take the board certificate. So it doesn't matter. So we can never say that one is better than the other. But at the end of it, if you have a board certification, it makes much difference in your practice.
Absolutely. Would any other panelist like to add on to that? Whatever Grace has answered?
No, I think Grace did a very nice job. I don't compare residency training or board certification. I think it really depends upon someone's journey as well as what they have access to. And as Grace so eloquently articulated, is that, maybe not everyone can earn a residency training program, or maybe their country doesn't offer board residency training. And so to that point, practice experience, at least 50% of your time in activities within the Continental line is a part of the eligibility criteria, or multiple paths towards eligibility that BPS does recognize.
Thank you. So moving on, next we'll discuss about the documents that are required for the application process. So as the first step, the candidates need to create an account in the My BPS online submission portal. So the candidates need to submit an electronic documentation of their current active legal authorization to practice pharmacy in their country of origin or residence. Also, a sealed hard copy of the transcripts of graduation with a seal that is sent directly from the college or university from where the candidate has received their pharmacy degree is required. So please make a note here that this document needs to go directly from the university to BPS. I'm sure for those pharmacists who are planning to take board certification would have a lot of doubts regarding this application process. Hisham, could you briefly walk us through the application process? And I think it would be really helpful if you could also share any practical tips from your experience as well.
Thank you, Vrinda, for the question. So just taking you through the process of how do we upload and what are the documents required for the application. A practical tip which is needed is, like, as you know, all graduates from India, acquiring these documents would take time. So just make sure that you have enough time to get these things. So get these things in sense. First, you start off with creating an account in my BPS online portal. On that, you go on and register yourself, put in your name, your location, and what is your practice. You need to also enter the highest degree which you have, your current license. So all these comes as documents which is required, which you already have, which you don't have to go back to the universities, because by then you'll already have these things. If you go under the international candidate section, you would have a graduation examination request form, which is needed for you to send the application to the university and ask them to send it towards BPS as by a post. So when you create an account in my BPS, you'll get a BPS ID, which is needed to be entered in the form. And along with that form, you fill in the required details on that form. You submit it to the university or the college for the transcripts. So the transcripts, copies of the transcripts, which is a consolidated mark list of all your graduation certificate or things like that from the college or university, along with this BPS, the graduate documentation request form should be sent to BPS by post. This is the only document which is required for international candidates to be sent by post. And most of these applies for candidates in Indian subcontinent because some of the countries, they already have it can be done as an electronic process, like Saudi, Canada, US and all. They could do it as an electronic process, but most of them who apply from Indian subcontinent and all would need these documents in. So just make sure you have the adequate time to acquire these, because you may be working in a different part of the country or outside the country. So you just have to get these documents ready when you start the application process, and the application process happens in one go. So one go in the sense you don't have an option to save and then come back. But if you have these documents ready, then you go ahead and complete the process so that you get all these cleared. So things required is my BPS online portal. You need to create an account, make sure that account, your name, everything is right on that, just because subsequent documentation, everything happens through with these details. You have your degree certificates, the highest qualification certificate, and your current practicing license ready or scanned copies. Plus, you will have to download a graduate documentation request form, which would have a BPS ID to be mentioned in that. Along with that, you send this to the university or the college for the copy of transcripts, and this has to be sent from the university or college directly by post, which has to be sealed to the address in the BPS web. I think these are the documents needed, and subsequently you'll need your experience certificate, which the practice experience certificate, which we discuss in subsequent slides.
Perfect. I hope the practical tips that Hisham has shared would be helpful to all those pharmacists who are listening to this panel discussion. So please make sure that you plan ahead of time. If you are planning for a BPS certification, make sure that you acquire all these documents in time, and you don't need to hurry at the last moment. So another document that is required for this application process is an employer verification. So a template for this, which you can see on the screen, is already available in the BPS website. So please make sure that you fill it up and get the required signatures from your employer, and that is also submitted along with your application. Also note that the required practice experience must have occurred within the 7 years immediately preceding the application. So please make a note of these points. So we have a couple of questions on the application process, which I would like to direct to Ajmal. So the first question is, if a candidate has the required experience, but it is from different institutions, is that still considered eligible?
Thank you, Vrinda, for the very good question. So I can answer this question from my personal experience. I have experience from different institutions. One is from India and one is from UAE. And I submitted this employer verification letter from both institutions. So it is accepted to have more than one experience, one employer. So you can get the employer verification letter signed by the supervisor or the pharmacy manager. No need to be from the HR. This is not mandatory. It is they consider from the supervisor or the pharmacy director, and you can submit. If 2 or 3 experience you have, you can combine it and submit. It's accepted.
Just a point that I would like to reiterate here is that if you are planning for BPS certification, when you move out of an institution, please make sure that you obtain these employer verification documents so that you don't need to come back at the time of application and run behind these documents. So that's just one point that I wanted to reiterate. Another question that we have got is it mandatory for the candidate to be still working while doing the program? Can I take a break and try pursuing the same, like a short course or so?
Thank you, Vrinda, for the question. Actually, it is not mandatory to be still working to be eligible for the exam. The term we have mentioned in the slide is that 7 years immediately preceding the application. At the time of application, within the 7 years, you have this experience, like 3 year or 2 year. You should have based on the specialization. So if you are not currently working, still you are eligible for the exam. You can apply for the exam.
Right. Would any other panelists like to add on?
Yeah, I would say to add on to that, I think the benefits of board certification is really to show to the patients and the employers how a pharmacist is contributing to their own lifelong learning. And what we're seeing is that a lot of employers are requiring board certification and are also providing some assistance to help folks become board certified as well. And so we recognize that the job market can be challenging, and there may be some times in which someone has to step away from practice to take care of their family or change practice settings because of the changes in the practice. But I would say that we hope that board certification really validates that someone has the knowledge, skills, and experience to contribute to the healthcare system and improve patient outcomes through board certification. And so I would say that we hope that folks have the experience, obviously, before they sit for the exam, but also throughout their career.
Thank you, Brian. So to just clarify here, when I read this question, I had a feeling that the participant has confused a BPS exam to a course. So please understand that BPS is a certification exam and it's not a course per se, it's not a program. Am I right in saying that, Brian?
Yeah, and I think what you're touching on, and it's an earlier slide, but oftentimes folks will confuse or conflate board certification with certificate training programs. So here in the US, we do have certificate programs for pharmacists and even student pharmacists and from that perspective to take these CE courses, take their own sort of assessment based on learning activities and become and complete training to provide immunizations or for diabetes management or other teaching certificates. And I would say that's a lot different than board certification, where board certification, you should be actively practicing, you should be sitting for the exam, and then even after you earn the credential and hold the credential, there is a component of maintaining practice in any and all of the content outlined.
Thank you. So moving on, now these are the various resources that are recommended for preparing for board certification. So Hisham, as someone who has taken 2 board certifications, could you briefly talk to us about the various resources that you used while preparing for these exams?
Thank you, Vrinda. This is a very important question, just because resources are what we start off with for preparing for the exam. So a couple of things which is available in the BPS website it has a very good guide for candidates on the process and how do you apply for that and the examination content and things like that. So if you would have a chance to look at the BPS website, specifically the International Candidates Guide, it'll be really useful to help you take you through the process. Along with that, all the different specialty exams have their own examination content outline on it. So it will be also give you an idea of how much of weightage has been given to each aspect of the examination. Plus, you also have a recertification guide on how do you get these recertifications done, along with after you complete a certification program, how can you maintain that? So all these resources are available in the BPS web. For preparing for the exam, you have some non-BPS resources, which includes review course, examination preparation, and mock examination, or things like that. What I've done is I've prepared from the American College of Clinical Pharmacy contents, which have been prepared for specific exams. So if you take any of these specialty exams, they have their own contents for the exam preparation. Plus, they have mock examination also available, which is available on purchase. And all of these are really useful materials which would help you guide you through the process. I would say that would cover most of the examination content which is there for the exam. Plus, if you're looking for something which is updated, always go for guidelines and journals and studies and all, which would really be useful, just to make sure that you are in par with what has been there, and it will be useful again at the time of examination. That will help you stay up to date along with the materials which you already gone through. So reliably, I would say make sure your most of the preparation stays with the exam preparatory contents and the mock examination, which is provided by the American College of Clinical Pharmacy in the website. The same thing, there are multiple other resources which is available, like ASHP, SIDP, and multiple other organizations, but majority of your learning would be through these review courses. Plus, if you ask me about study groups, I personally, after I've completed my board certification, I knew multiple people. Again, it's even in this panel, you have people who came to me asking, how can we go about this? So we've created certain study groups within our team, so that they could learn as a group in that team, and they could share what they've learned and how the process, and guide them through. So personally, study groups are really good if you really utilize and make use of that as a group, and you learn from each other. And again, if affordability of the materials are also an issue, so that some of them, what they do is they purchase the material as a group, learning materials, and they discuss it in the study group as well. So these are few tips and tricks which would help you through preparation of the for the exam as well. So these are depends upon the person as well. So majority falls in these groups. And again, if there is say, for example, if someone's planning to take up these examination in future, for sure you have so many people in this group whom you could reach out to if you're planning for any study groups, so that we could connect you with the right people and the right groups, so that the serious exam takers to work together for a specific exam. That makes it easier, because the practice may differ, and along with your work, you could plan a combined study, things like that. So those are few tips and tricks for resources and how do you go about by the exam.
Thank you, Hisham, for sharing those practical tips and tricks. I hope those would be useful to our participants. So we have received another question from participant that the guidelines which are to be studied for BPS exams are international guidelines, which may not be applicable to the Indian scenario. The participant has asked if BPS could consider including experts from the different countries while designing the exam content as well as questions for the exam, so that it is applicable to candidates appearing from countries even outside the US. So probably I could direct this question to Brian.
No, absolutely. And I want to just to build upon Hisham's response in terms of, BPS doesn't endorse or support any particular preparation courses. And so even though he has identified a few of the pharmacy organizations that provide these courses, our exam are independent assessments of someone's knowledge, skills, and experience, separate from preparation courses. And I guess in addition to that, I would say that you are free to sort of study on how and the best ways you feel is needed. And that's one of the reasons why I think a lot of our international candidates do take preparation courses, because this is a US-based exam that is exported to other countries. I think it would be a little overwhelming to really settle, which guidelines, depending upon which country you live in, would be useful in building an exam. One of the things our colleagues in other parts of the world will do is contribute questions to the item writing sessions, as well as serve in our specialty councils to help differentiate what type of questions are more relevant for, say, a US only audience, or even what questions would be a little bit more broadly applicable. So I guess this is sort of a call to action for folks on the call that are board certified to consider contributing items for the exam. And we have a call for item writers on an ongoing basis. We also have a call for specialty accountant applications as well throughout the year. So, and we do recognize that there are different treatment guidelines, but again, this is a US-based exam that does get exported to outside the US, but I would say that we do take into account different perspectives on the exam, and that's through some of the activities we do in our exam development activities.
Thanks, Brian, for clarifying that. So now let's move on to the content that need to be studied for the different board certification examinations. So for infectious diseases specialty, the major weightage is given for patient care and therapeutics. Now, due to time constraints, we will not be able to discuss in detail about the exam content, but you can visit the BPS website, wherein you can find all the details regarding whichever specialty you are interested in. As a pharmacist who has cleared this exam from India, Grace, could you tell us how you divided the time and prepared for the exam? I think the participants would especially be interested to hear from you any practical tips that you could share from your experience on how you were able to complete studying everything.
Yeah, so with regard to me, see, I have taken, like, if you look at the eligibility criteria, I had that 4 years of experience and 50% is what I had. So before that, I mean, what we need to know about while preparing for this exam is that we need to, because this is a US-based exam, like Brian said, we need to know the guidelines. So start preparing as soon as you are trying, if you're interested into board certification, or if you're interested into the clinical practice, it's the best thing you can start ahead with the guidelines. Know your guidelines. So what I have done is that I have downloaded all the ID related guidelines from IDSA, and the the major guidelines that people use to make their protocols, their guidelines, and things like that, for institutional guidelines like that. So having downloaded all the IDSA guidelines and things like that, I started reading each one by one. And then I had the review course with the ACCP, ASHP, the review course as well. And while you are learning from, once you learn the guideline, then you go into, let's say, community acquired pneumonia. It makes so much sense. It makes so much, so much more importance as to why these drugs of choices are there in the guidelines, and why it's been, reiterated in all these protocols that we are seeing. And the thing is that once you learn through different, like I said, I first had the guidelines, and then I went through the SHP, ACCP certification book, that course that I did. So these are all different formats in which, people put in the SHP, ACCP, there'll be questions. In the guidelines, there'll be studies. So when you're reading through different perspectives, things hit you differently while you read through these different methods. And that's what helped me. I think that really helped me in understanding the disease more. And like Anita said in her previous saying that through working through this, while studying through this course, it actually helps you into molding yourself, being a better clinical pharmacist, because you're reading a lot of information that you didn't do when you were either when we were practicing. We were just going with the flow. Now it puts you into perspective, puts you into that standardized care. And with regard to how you divide your time, that's a very good question. And what I did personally was that I started preparing for, like I said, I started preparing for this maybe around 6 months before taking the exam, and started studying the guidelines. I also did the SIDP course into antimicrobial stewardship, because that's what I was interested in. And then with the guidelines, once you purchase your material, then along with that material, you slowly start to, put things into what I did personally, if you ask me, is that I created an Excel. So in that Excel, all these domains, that whatever you see in the BPS website, what are the major, let's say, what are the major, let's say, meningitis, community acquired pneumonia, ventilator associated pneumonia, all these major subdivisions I have created. And I just went through quickly as to how much time it is going to take for me to study each guideline, because some pages, some guidelines will be like 80 pages, whereas others will be like 2 or 3 pages. So you divide your time accordingly, and you know which are your weakest points. For me, one of my weakest point was HIV. I never had to deal with HIV patients, so I never knew about HIV, but I knew a lot of questions are going to come from HIV. So in the patient care and therapeutics, one major thing I would like to say is that you cannot skip one thing on that, in that whatever syllabus has been given by the BPS. Never take that risk of skipping certain portions from, because you don't know how many questions, whether it's going to be out of the 175 question, whether it's going to be 10 questions or it's going to be 1 question. You can't. So never try to just skip portions and only concentrate on certain things. You have to go through everything and know your weak points. Spend more time with your weakest, where you have the weakest knowledge in that area, and have more time to ensure you conceptualize everything what you are learning. And the best study tip that I can give you is that while you are doing this preparation, make sure that you're making notes. Okay, because I'll tell you my personal experience. After doing this thorough SIDP, after going through the guidelines, after doing the SHP, SCCP course material, I tried to take the mock exam for this board certification. And after the first 10 questions, I started crying because I couldn't remember a thing that I learned, because there's so much information that's there, and the answers are also, it can be confusing. So what actually helped me with that one is the notes that I created. So for an 80-page HIV topic, I had made a note of 3 or 4 pages. And the critical information, whatever is needed, whatever is confusing, I had written it there. And so that I could revise it. So once I had studied it in depth, I knew which are the guidelines, where to go and look for certain things if I didn't know. And because of these notes, I could revise. So I had done 2 revisions after doing all these things, after doing this 2 revisions, because in a way, like every other competitive exam, your short memory is going to be tested at the examination. And also, if you're, if full-fledged practicing in US, it might not be required because you're seeing cases on a daily basis. But when you compare with US and the India, I mean, the guidelines may vary a bit here and there. The drugs may vary a bit here and there. Therefore, have these notes. Make sure you do your revisions at least once or twice, if possible, before appearing to the exam. So I took 1 month off from my schedule to learn this whole thing. And towards the last, I think the last 5 to 10 days, I just revised whatever I had learned. I just revised over and over again because I knew which are my weak points, where I'm getting all the questions from. So that's when I started revising. And that's the only reason why I think I got the board certification my first chance itself, just the revisions and the notes. So that is my biggest tip that I can give everyone.
I think you have spoken about the whole journey in a very comprehensive manner, and I'm sure everyone will be able to take at least few points from your experience. So thanks a lot for that. So moving on, next we'll discuss about critical care pharmacy specialty. Here, the major weightage is given for treatment planning and pharmacotherapy. So Hisham, as our expert panelist who has taken this exam, could you share any practical tips for our participants on how to prepare for this exam while having a full-time job? I think just keeping in mind of our time, since Grace has also already talked about in a very elaborate manner, probably you can focus on adding any few points to that.
Exactly. Thank you, Rinda. So just for taking critical care pharmacy specialty exam, like what you need to focus, your clinical experience really matters over here, just because your decision in which how much of what if you look at the exam, almost all the answers would be are right answers, but what you choose out of that was the best option is most important. And in this, your clinical experience really matters quite a lot. So if you ask me, how do you go about with exam preparation contents like that? So for me, when I personally took up this critical care exam, I actually waited for those 4 years to complete so that I could go and rush and take this exam. So that was my part of it, but just because I knew these are really useful contents which would help me improve my practice. So as soon as I relocated to Abu Dhabi, I had colleagues who were taking these exams and who already took these exams or planning to take these exams. So we had a kind of discussion study group where we used to read and study and then come back and discuss. Along with that, because our practice also changed, a group discussion definitely helped us for preparing for these exams. So majority of them would be kind of clinical questions and more of like treatment wise, pharmacotherapy wise in critical care. Plus, when you have these group discussions and things which would really help you as a group to go ahead and prepare for the exam, that will be really useful. Again, being in this part in UAE currently, again, we have a group in which we help students also in our hospital, where students were planning to take up, we go through the questions and we kind of train them in such a way that during their PGY1 itself, they're ready to go ahead and take the pharmacotherapy exams and things like that. So my advice and tip would be like from my practical experience is just make sure that you have you speak to people who've already taken these exams, and because that really matters quite a lot. Along with that, your clinical experience really matters, because the right decision. So if you look at the options, all 4 answers would be right. What is the best option you would give for the patient is what matters, and that is the best treatment. You actually want that. So all these conversations gives you more clarity as you discuss with people who've already taken these exams. And if you work as a group, that group helps you take the exams even easier, just because you're discussing why and you're justifying what are the treatment options, why is this the best when you rationalize from the others. So that would be my simple tip to stick to the time. And that's it. Study groups, like having conversations with people who've already taken the exam. And again, just conversation in the beginning may not may not alone be useful. You need to also read the content and get back to the people if you have any doubts. That's what exactly I've done before. Thank you.
Thank you, Hisham. So moving on, now let's discuss about pharmacotherapy specialty certification. Please note that this content outline is effective from January 2024. So as per this content outline, the maximum weightage is given for topics such as developing patient-centered evidence-based pharmacotherapy plans, monitoring the patient to ensure safe and effective pharmacotherapy, modifying the pharmacotherapy plans, communication, and education on the safe and appropriate use of pharmacotherapy. Now, there is another content which is available in the BPS website, which will be effective from September 2024. So please refer to the website whenever you're preparing for the exam to make sure that you are preparing as per the last updated content list. So Anita, as our expert panelist who has cleared this examination, could you share your experience on how you prepared for the exam? Any additional points that you would like to share that has not been already discussed by Grace and Hisham?
And whatever you study, it's not going to end anywhere. And that make sure you have all the content of the BPS agent, so that you have a of view of the domain. They have changed the curriculum, and I'm thankful to BPS for making it much better than the previous one. It gives us good clarity on where to focus, because previously it was like whether it is an ophthalmologic disorder or a cardiovascular disorder, both should be given equal importance. But new syllabus is like pointing out which all areas to be focused specifically. So as Hisham mentioned, the content outline is something which you should understand thoroughly, including the domains and the division of the percentage of the marks, and have an idea about how many you are going to meet domain. That's one point. And pharmacotherapy, it's going to be a roller coaster for you, because the pharmacotherapy, the treatment part, the evidence-based medicine, biostatistics, research. If I'm right, this specialty is gonna have the maximum number of questions on statistics research part, and it's not going to be an easy thing. And if you're planning to focus more on pharmacotherapy and leave the statistics part, maybe you can be sure that you're going to fail the exam, because that's what I read from others. Like they are telling, if you are fully confident in the research, maybe the chances of passing the exam is kind of high. Because pharmacotherapy, it's not sure that we can attempt all the answers in a right way. But if you can get all the statistics or the research questions correct, it gives you a better chance of passing. That's one way to look at it. So make sure that you don't leave any domain or any part of the content outline without preparing. In case if you're not able to finish it, make sure that you revise whichever part you have learned. At least being thorough in whatever you have learned will again give you a better chance of passing. Another thing to mention is whether you are learning to pass the exam or are you learning to improve your of be. And due to some practical difficulties, I knew I couldn't do it. So when my colleague mentioned about this board certification, I thought of utilizing it. And thanks a lot of specialty for giving us this particular unique opportunity to do the certification even without a residency. So I took this, and I took this exam to learn more, and it took almost 3 years for me to prepare and pass this exam. So let me tell you one thing. Don't be sad or don't just drop it if you're failing this exam, because if you look at the pass rate, it's kind of very tough. It's almost around 6%. And I want you people to know that I failed twice and I passed on my third attempt. So please don't stop even if failing. Just take it up, just learn again. And preparing for this I learned a lot, and I used multiple resources. And better I not mention whatever I used. It's going to be like, just do a good research regarding how people felt with each review material. Each one has their own experience. It was an so it totally it's based on what you know at that point of time. So just a minute. So it's like, if you're practicing in a general medicine area, it's going to be easy for you. But as a clinical pharmacist working in neurology, it was kind of tough, because many specialties which I was not exposed to was a bit tough for me, especially the gastro, pulmonology, oncology was something which I don't see routinely. Only cases which I saw was the neurological complications which used to come in these cases. So it's going to be a very tough thing. And especially if you're practicing in a single specialty, make sure that you provide enough time for yourself to prepare. So me taking 3 years of time doesn't mean that you will require the same amount of time. You may even pass it in your first attempt. Even if not, just make sure you give it another attempt and learn more. Give yourself some time, take a break from it, and just reattempt it. Okay. That's the main thing I want to tell you. I don't know how many people will speak up for failing the exam and reattempting it, but it's not something bad you should feel about yourself. This is not something which is going to assess you. It's just assessing your knowledge. And there are so many questions they are skipping, and so many areas you must have learned, but they have not brought any questions from that. So don't take it as something judging about yourself. So keep learning, and it's not going to be something like preparing for the exam for like 3 months or 6 months. What I did was, I used to learn a topic and I was trying to apply it in my patients. I used to have discussions with my doctor. I used to utilize my practical experience and my clinical rotations for applying those information, especially during patient counseling. I used to recollect all the ADR. I used to tell them about the complications, the monitoring parameters, what follow-up they have to do, and what treatment outcome is expected from this particular treatment. So all those interactions with the patients, the discussions with my doctor and the interaction with my team helped me learn and memorize those points. So it's not going to be a few months or weeks preparation, but make sure that you keep on applying whatever you learn. So that's the best way to memorize it. If you are not able to participate in a study group, or if you don't have anyone to communicate, utilize your patients and help them to learn more and keep your knowledge. And something else is
sorry
that,
to
again,
interrupt, Anita. We are just sort of running out of time. So
okay,
is there any other key point that we would like to discuss? Any other important practical tips?
I think that should be enough. If there is anything more, you can contact me. That should be fine.
Yeah, perfect. Thank you so much for reiterating the fact that even if the participants are candidates are not able to clear the exam in the first attempt, they should not feel let down, and they should definitely go and retake the exam, and that's always a continuous learning process. So thank you so much for reiterating that. So moving on. Now, BPS certification examination happens twice a year. For the first half of the year, the registration window is between Jan to Feb, and the testing window is between March to April. While for the exam in the second half of the year, the registration window is between July to August, and the testing window is between September to October. BPS has shared these dates, which you can see on the screen, and this is for the year 2024. Please note that in case these dates are changed, it will be updated in the BPS website. So please make sure that you always refer the website before each step. Grace, could you share any practical tips on how to plan ahead and apply for the BPS exam? So the window periods are quite short. So if you could share any practical tips on how the candidates need to plan ahead.
I think Hisham has already touched upon this one regarding how much time you need to give yourself before applying for this and depositing the money that you need to as a fee and everything. So as you can see that the window is quite short. Like you'll have let's say, I think 1.5 months time usually to apply for the that window period is open during that time. So like Hisham said, getting your transcripts from your university to send it to BPS is the most challenging one that I found, because especially it was COVID for me at that time. 2021 was COVID, so I really struggled with that one. So I like Hisham actually kind of guided me through it. Therefore, initially when the testing window was open, I just did it at that time. Initially within the first 5 days, I think I did everything. I made sure everything was ready, so that in case of BPS, because I was the first one to do it from India, I didn't know whether they would reject me, whether I need to send it once again, or some delivery issues due to COVID. So I gave myself enough time so that even if it gets rejected or if they didn't get it, so I'll have time to resubmit it all again. So that's one thing that I did, and one thing that I would advise all of you who are taking exams from centers other than the US and the other established ones.
Thank you, Grace. So few of the specialties also have continuous testing administration that is available. So currently this is available for specialties like cardiology, nuclear pharmacy, psychiatry, and oncology. So this option is also being extended to few other specialties, which would be effective from next year. This information has been provided by BPS. So please visit their website before you're applying to make sure if this option is available for your specialty of interest. So next is about the examination fees. So currently these are the examination fee for the certification exam, recertification, and the annual maintenance fee. So we have a question from the participants for Brian here. So $600 is what the cost for certification exam is, which would come to about 50,000 Indian rupees. So just to give you an understanding about the Indian context, the average salary for a practicing clinical pharmacist in India comes to about 25,000 to 30,000 Indian rupees per month. That would be around $300 per month. So this is per month salary. So it would almost take 2 months of salary for Indian pharmacists to pay the examination fee. And this is a major challenge for pharmacists applying for BPS certification from India. And in addition to that, there's also cost for exam preparation materials. So our participants are interested to know from Brian if there are any discounted rates available for candidates from LMICs such as India.
No, it's a really good question. And I would say that, over the past 20 years, our BPS certification fees and recertification fees have really remained in place for about 20 years. I went over to my local commercial coffee shop and recognized it was a $5 USD just for a normal cup of coffee. But if you look 20 years ago, it was only a couple of dollars, right? And so I would say that, what we're learning in the US and around the globe is that really the value of board certification, really touches on a couple of different drivers: the government, employers, obviously board certified pharmacists themselves. I was in Singapore just a couple of weeks ago, and even some of the hospital pharmacist leaders there have actually created a scholarship program in their institution to help pharmacists not only prepare for the exam, but also to cover some of their certification and recertification costs. In Spain, similarly, the National Hospital Pharmacy Society there has developed a scholarship program for pharmacists to pursue board certification, specifically in oncology pharmacy practice, because that's an area of need for the country. And even here in the US, we're seeing employers offer reimbursement for fees and/or require board certification as a part of the whole salary, not just part of the salary. So I would say that there may be some opportunities to explore scholarships within India, maybe working with some of the local or national leaders, and really trying to articulate the value of board certification, so that way these fees are really covered by are defrayed from the certificates themselves.
Right. Thank you so much. So now coming to the actual exam. So there's a total of 175 questions, which is divided into two parts. So part one has about 100 questions, for which the maximum time allotted is 2 hours and 30 minutes. And part two has 75 questions, for which the maximum time allotted is 1 hour 53 minutes. So this is a computer-based examination. So the candidates can actually bookmark items, review, and change the answers in each section. But what you need to make sure is that you complete the answers in that section before you move on to the next section. You can't go back and change anything to the previous section. So that is one thing that you need to make sure. So this exam format might change from 2024, and these would be updated in the BPS website. So please visit their website for more information. Now, I would like to quickly ask the panelists to share any tips on how to manage the time and complete the exam on time. So I can start with Ajmal.
Hi, Vrinda, for the question. Regarding the time manage for the exam, you have two sections, 100 questions for the part one and 75% for the part two, and there is a 30 minutes big optional break. So whenever you start attending the exam, from the question number one, you have to, I suggest to attend all the questions, whether you are sure about the answer or you have doubt or you don't know the answer, just attend the answer. Don't leave without attending the answer. And if you already attend some kind of Gulf exams, you know the Prometric exam has option for flagging the questions. So if you are unsure about this answer is correct or not, just flag the item. But if you are sure, or like 80% or 100% sure the answer is correct, do not flag. This is my personal tip, because if you flag too much items, when after finishing the attempt, you will find a lot of items in the flag list. So you don't have time to review all this item again. So if you are like the 80% or 75%, the answer is correct, you are sure about that, then leave it, don't flag. But if you are doubtful about the answer, just flag it and move to the next question. And while preparing, you have to focus on this research and statistics part, because it was one of the difficult part for me. So there will be some calculations, you have to use some logics to get the answer. So if you feel some question taking too much time to get the answer, just leave it, or just attend to any of the answer, randomly choose, then go flag it and go to the next question. So in that way, you can avoid wasting the time. So the time schedule, like 2 hours 30 minutes for the part one and 1 hour 53 minutes for the part two. This is, I feel from my personal experience, it is like absolutely correct. You will not get extra time. So once I flag, I get time to review the flag item, because I flagged only the appropriate the doubtful questions only. So in that way, you can manage time, I think. And again, I'm saying this statistics and research part, you have to be more careful about that, because I was feeling a little bit difficult when preparing. So I sit with one of my friend. He's from my nearby hospital. So maybe 1 week we sit every night, maybe 1 hour, 2 hour. We had a discussion, and he helped me a lot to cover this part.
Thank you so much, Ajmal. I think that was a very helpful tip that you shared. Grace, anything to add on to that?
Yes, just one real quick thing. This is regarding for all the MCQs, not just for anything. I mean, not just for the BPS. It's especially because if you look at this 175 questions that you are going to answer, all of these are going to be case-based. None of this is going to come as what is the mechanism of action of tetracycline. It is going to be a long case followed by a short question. So my tip to all of you, I mean, you can take it or leave it, but the one thing that I usually do is that I always read the question first. Without going through the case first, I read the question first and then go to the case. So that anyway, because you'll have to come after reading that question, you'll have to come back to the question and read it all over again as to what, they will be discussing about so-and-so year old patient with so-and-so comorbidity, so-and-so things. What is, and the drug treatment and what is the drug interaction? That would be the question towards the end. So if you know that is the question, while you're reading the case itself, you know what to concentrate on. So that is one thing that it really helped me while taking the exam. And it's just a suggestion, not that it's mandatory. It's something that really helped me. That's the only one I need to add.
Yeah, I agree with the Grace. This same tip I also use. I always start with the answers, actually. Answers or the specific question I will focus. Then I will read the answer. Then I will go to the case. Then maybe sometimes you don't have to read all the case. You will find the answer before that. In that way, you will save a lot of time. Definitely.
Thank you. Hisham, anything to add on to that?
I think just something new which I would want to mention is you need to gain speed. So you'll have to work a lot of questions before, so that you get to the process of reading those questions quickly, answering it quickly, kinds of things. So a pre-exam tip would be practicing a lot of questions, which is available in the material, separately the mock questions as well, so that when you are on the exam day, you gain speed. And like whatever others have already mentioned, I echo to that as well, because that's absolutely what even I've done.
Thank you. Anita, anything to add on?
Yeah, I think I can kick off a debate on what Grace maybe just mentioned. So there are two aspects. If you start with the main question initially, it can be kind of misguiding when you go through the case scenario also. Most of the questions, they don't come with the direct answering capacity. So there will be some kind of clue inside the question, and if you go to the main question initially, you might even read the case scenario in a wrong point of view. So it's like based on the question, it depends. So I'll always prefer starting from the beginning. But if it's a direct question, fine. But there are questions, I don't know, maybe ideas are a bit different from pharmacotherapy, but pharmacotherapy is full of case scenarios and direct questions are very rare. And it might be a drug interaction which you have to think about it. They may not even ask what is the drug interaction going on. So from the choices, you might feel like all the choices are wrong. That is also a possibility. So from that thought process, you need to find out what you are trying to take from this question. So it may not be applicable all the time, but still some cases you might benefit from reading the final question alone also. So it's all about working out more MCQs, as Mohammad Ishaq mentioned. So just learning the theory, going through so many treatment and statistics is not going to help you. Learning how to apply whatever you learned into the question, that requires good number of case-based question, like working out more of multiple choice questions. You need to know how to rule out the answers. You need to know how to rule in the answers. So the first one you strike out may be the right answer. And out of the 4 options, most of the time 2 or 3 will be the right answer. And from that, you need to choose the best one. So that requires some training and practice. So revising whatever you want, trying to applying it into the question, you need to tune yourself to these MCQs. So that requires some amount of practice. So without working out MCQs, please don't go for this exam. It's going to be really tough. You're going to miss out on time. So if you want to do time management, the first thing you need to do is work out MCQs. So you will get to know what to learn and from what point of view you should learn and complete each chapter. That's going to help you really.
Brian, would you like to add anything to whatever has already been discussed?
No, I just really want to say thank you for the stories that we've heard from our colleagues and their bravery and their courage to go through this process and the scrutiny towards earning board certification. I think they did a phenomenal job highlighting that today.
So I think the participants have got quite few good tips from our panelists on different aspects of how to crack the exam. So moving on quickly. So these exams are held at Prometric testing centers. So candidates must familiarize with the site location and make sure that they're on time at the site. So if you're arriving late, 30 minutes late, you will lose your seat as well as the registration fee. And you also need to carry a hard copy of the testing confirmation email as well as a valid photo ID. Grace, as someone who has applied for the exam from India, were you able to select the Prometric site specifically? And could you also tell us what were the documents that you had to carry to the exam center?
Yeah, thank you, Vrinda. I think that is one of the concerns that many of them have regarding where is going to be your testing center. So like you have already mentioned, Prometric is your testing center. And while you are logging into your My BPS portal, they will ask you and you have to go to the Prometric website also to feed in your, your details. And in that one, you'll have to provide your PIN code, right? Your postal code. So I think what has happened with me is that because I didn't know where I'm going to get it. And because I chose, and I mean, when I entered my postal code as somewhere from Kerala, I got mine in Trivandrum, which is the capital city of, Kerala. And I think I just spoke to Anita earlier, and she had, registered from Coimbatore, which is in Tamil Nadu. And therefore, what she got is Bangalore, because I think Bangalore is near to Coimbatore than, Chennai. So it's based on the postal code that you put in. They will select the centers, but you can't, I don't know whether you'll have multiple centers to select from. Maybe in India, slowly things will change. But for me, there was only one center. And I think for Anita also, there was only one center. Bangalore was the center for her. So that is the one thing, based on your postal code is the answer to your first question. And to your second question regarding what document you need to choose. One thing I want to make it very clear is that in the Prometric website, they have very specifically given the details for your proof, your ID proof. What they have suggested is a valid government issued photo identification with signature, okay, is something that BPS has already, in Prometric Center, they have already mentioned for BPS. Okay, so Aadhaar is not something which has your signature on it, but your passport has it, your PAN card has it, and some state, driving license also might have. So the best thing to me would be the passport to carry with you. No harm in taking the Aadhaar, but Aadhaar will not be the only one that, they will ask for. You need something with the sign on it. So go through your documents all together and see which of these has a photo and this signature in your ID. So that's what is required for the Prometric Center testing center.
I want to add one point. In UAE, the situation is different. Like we have a choice to select a center. We have two centers in Dubai and Abu Dhabi. So when I apply the exam, I have option whether I can choose Dubai or Abu Dhabi. I think in India there is only one center they are allowing.
May I just add, maybe that's because there are only limited number of candidates who are taking the exam. It's not like, there are not many people who are taking the exam. So they can't, spend all their resources to, spread it across the country. So wherever, they have enough seats, I think they'll try to cram it up together. So it's easier for them to conduct the exam also.
Yeah, you're right.
I would like to add on regarding the two questions she answered. One is the Prometric Center. Actually, you can choose it. My first two exams I did in Chennai. I couldn't get the Trivandrum, and Chennai was the nearest one they suggested from Prometric when I entered the Coimbatore code. But third time again, Chennai was a suggestion. But since I failed twice, I just wanted to try a different center, and so I picked up Bangalore. So that's always an option. You can even go to Mumbai or Hyderabad. So it's okay. You can choose your city, and I think only one center in a state. So if you want to take a travel before your exam, maybe you can choose a distant one, so that have a relaxing travel, go and take the exam. And regarding the ID which you mentioned, passport is the best to have, or driving license is something which they mention in the mail they send from Prometric. But even with the driving license, they want some other ID to just cross verify. So if you are not carrying a passport, make sure that you have your Aadhaar, PAN, and driving license with you. Because one day prior to the exam, you'll get a call from the Prometric Exam Center, and they'll give you the guidance what all to bring. So make sure you have it in your hand. In case if you are going out of the state, it won't be an easy decision to come back and take the ID again, and they won't let you inside if you don't have it. So just take the 3 if you don't have a passport.
Yeah, no, these are really good comments. And I think as we continue to grow the number of pharmacists interested in sitting for the exam, the number of locations in India will also increase. I'd say the other tip I would add to the conversation is that the name in which you put in your application to register for the exam should match the name that's on your driver's license and or your passport. So making sure that those names are the same, I think will also help with the process to enter into the testing center. Because if there's different names, then the testing center administrator will may scrutinize your identity a little bit more. So making sure that the names match are very important.
Thank you so much, panelists, for clarifying all those points. So quickly moving on.
One quick point, Vrinda, sorry. It's like if you want to send a nearby your location, just make sure you apply it as soon as possible. As the days pass by, you lose the seat. So better do the appointment fixation as early as possible.
Thank you. So now coming to the scoring and reporting, the scores are reported within 60 days of examination, and it will be available within the My BPS portal. So scores range from 200 to 800, and you need to score at least 500 to pass the examination. Physical certificates will be mailed within 90 days of score report. And in case the candidates does not achieve this passing score, like Anita already mentioned, you can retake the exam, and this will be available for a reduced fee. So one question that we have received here is how many attempts are available to retake the exam? So Brian, probably you could answer that question.
Yeah, so we're looking at 3 attempts within a year. And then after that year, you may have to, there may be a waiting period before you can actually apply for the exam again. And really that's to the benefit of the candidate, because we don't want you to continue to take the exam. And if you're not fully prepared, whether that's through your studying or whether through practice experience. And so, and we're really instituting that not only just for our testing windows, but also within our continuous availability testing model. So you do have to wait some time in between each retake, but we are focused on a maximum of 3 attempts within a year, and then there may be a washout period that you'll need to wait before you can actually apply for the exam again.
Thank you, Brian. So we are coming to towards the end of the presentation and the discussion. So the last part is maintaining board certification. So Hisham, could you just quickly walk us through the process of maintaining board certification, please?
Yes, I can. Thank you, Rinda. So maintaining the board certification is very important. It's something which is it's getting a board certification. It's not a destination. It is a continuous process. You need to understand that. So it is very important that you maintain it. And it is like a career-long learning process where you've invested to make sure that you're up to date with all the resources you have, and to make best utility of that would help you give the best care for your patients. So it's not like a N degree, like a PharmD degree or residency program, or like a training certification program. This is something which lasts for, you have to renew or recertify every 7 years. How that can be done is you have 2 options. Either you take the exam one more time after 7 years, or during the 7 years period, you could get credit points through attending multiple you purchase reading materials to maintain credit points, or attending CE programs, along with BPS is associated with the C credit points, which comes along with this is got through different organizations like SIDP, ACCP, SHP, and these organizations provides credit points. The easiest way is to purchase the ACCP materials, which say for example, you can get it on the ACCP store. You'll be able to purchase it recertification program, or recertification programs contents, where these would be a book of contents where you can approximately around 15 to 20 credit points would be there in each book material. And you may need, for me particularly for doing critical care and for ID, you need 100 CEs each. So this 100 CEs, you could acquire it over a 7 years period of time, either by doing these programs. For me, I would do the critical care self-assessment program, CSAP, or IDSAP, infectious disease self-assessment program. These are ACCP materials available in the store. And on purchase, once you complete reading these materials, there would be assessment questions where you complete those questions, you get those minimal score to pass these, so that you could maintain these recertification contents. And then at the end of 7 years, you get default recertified. So if you are not willing to purchase these contents in between, and you want to do it as one go and as a one take exam, then that could be done at the end of 7 years. You could retake the exam. So along with that, it's very important, make sure that this is not a board certification is not a destination. It is a continuous learning process, and it's not like a degree, it's not like a short course, or it's not like a training program. Just make it very clear, because quite a lot I personally know some of my colleagues who've just done the certification but not even bothered to maintain the certificate by reading the programs, which is not going to be beneficial. It's just adding the few letters at the end of the name is not again applicable, and it's not going to be beneficial at all. So I think that's what I had to add for this.
Brian, anything you want to add on to that?
No, I mean, Shyam did a very nice job. The other thing I would add is that we recognize that these recertification activities take quite a bit of time, take quite a bit of resources, the cost. One of the things we've heard from a lot of board certified pharmacists over the past 12 years is, there are activities in which you guys do every day in practice that should count towards recertification. And so, for example, if you're involved in precepting learners, or if you're involved in a scholarly activity, i.e. a book chapter or an article, or if you are doing grand rounds, or if you are going to medical conferences or other pharmacy conferences that aren't approved for recertification, then those activities should count towards your recertification. And so beginning in 2024, for anyone that's newly certified, beginning in 2024, or up for recertification in 2024, we are integrating this continuous professional development into our existing recertification pathways. And it's really like a 80-20 separation. So maybe 80 of your units would come from those recertification offerings that Hisham had mentioned. The other 20% could come from activities you're already doing in practice, as long as they align with the content outline. And those are things you're actively doing. And so I think that's an option for folks who are pursuing the professional development pathway. But even for folks who are sitting for the exam, writing for the exam every 7 years, CPD will be a required component each year, at least 2 units or 2 points per year to maintain your certification. And that's really meant to help support someone's lifelong or career-long learning journey, because it doesn't just happen, on every 7-year basis, but really learning should occur, throughout the year and every year.
Thank you so much, Brian. So with that, we come to this very interesting discussion. I hope this discussion was very useful to all the participants who joined the session today. I would like to thank all the expert panelists for joining the discussion and for sharing your valuable input. We would also like to thank BPS for collaborating with FCPI and for agreeing to join this panel discussion. Just as a last closing question, Brian, how do you see this collaboration between FCPI and BPS? What do you think would be the benefit, and how do you think we can take this forward?
Absolutely. And I would want to first say thank you to Brenda, you for moderating, Anita, Ijmal, Mohammed, Grace, all of you guys for being panelists with me to talk about board certification. I think the conversation should continue. As you probably know, we've been involved in this business since 1976, and then we've also been learning more about how each country has adopted and adapted board certification to their career development, their credentialing, the privileging pathways. And so I'd say it's really just learning more about how can we as a BPS grow with pharmacists in India and other folks throughout the world to help them to be strong partners and career development. And that might even mean having more conversations with the Federation of Clinical Pharmacy of India to learn about what are next steps to help support more pharmacists becoming board certified. We're happy to connect you with colleagues across the world who have developed scholarship programs and maybe model some of those activities to increase the access to board certification. So I would say we need to have ongoing communications, and I think this webinar really is just the start of that conversation.
Thank you so much, Brian, and we are looking forward to working with BPS. So last but never the least, thanks a lot for all the participants who joined today's session. I hope you were able to get a lot of benefit from whatever our expert panelists have conveyed. Unfortunately, due to lack of time, we could not answer many of the questions that you gave. So thanks a lot for that wonderful response. We hope you will be able to go back to the website and get your answers from the website, because everything is given in detail in the website. Make sure that you always visit the website before you go ahead with the application process as well as the examination, because it is constantly updated. So whatever we said today is updated as of September 25, 2023. So make sure you visit the website and also visit all our social media pages for any updates on oncoming activities. So yeah, I think with that, we can wind up today's session. I hope you all have a very good day. Thanks a lot.
Happy World Pharmacist Day.
Yeah. Thank you.
Thank you.
Thank you very
Same
much.
to you,
Thank
Dr.
you.
Brian.